morning to all of you. Distinguished chief guest of this morning, Dr. Sudhanshu Trivedi, the Secretary General of AHPI, Dr. Gyani, the founder patron who is here, Mr. Govind, and the chairman of the program, Mr. N Reddy, and the local president of the chapter, and other members of various organizations, distinguished leaders, and all the younger generation that we are seeing here. Probably more than 80% of this audience is constituted, in which the future of healthcare is truly upon your shoulders. I've been asked to speak on my experiences of global healthcare leadership by serving for greater than 40 years in the United States of America, then transitioning to this country to establish Continental Hospitals in the year 2013. Certainly, I had the greatest opportunity perhaps than any one of you here, with my due apologies, that I was able to see, from close quarters, healthcare leadership in both the continents and what influence we have from the West, what learnings we have, and what learnings that they would be having as we go forward. I want to just give you for a few minutes to set the stage for us to understand leadership. Before that, we need to know some facts. Across the world, global healthcare leadership truly began several centuries ago in the United States of America, where hospitals were established 300 years ago by basically religious leaders or religious societies and philanthropists. They were instrumental in establishing hospitals and managing hospitals. In the 19th and 20th century, continuing with the trend and the tradition, it was the Catholic sisters and other philanthropies who joined together to build bigger hospitals with proper infrastructure, and then incorporated medical professionals, later on governmental agencies and other stakeholders, came in. After that, Florence Nightingale, who was never forgotten, who gave to the world truly not just what nursing leadership is, but what exactly patient care is from the 18th century. Florence Nightingale's various principles of management of patients went across the Atlantic, and many of these very young hospitals started adopting not just about environmental safety and cleanliness, but about empathy, about compassion, about data-driven care. We talk about data-driven care in today's world, but data-driven care was born, ladies and gentlemen, in 18th century on the battlefields of Florence Nightingale served. She said, there is nothing that we can do effectively and practically, pragmatically, without having data to formulate your policies. So it dates as much as almost 250 or 300 years back. And thereafter, the American Medical Association, which was established in 1847, and in the 20th century, the American Medical Association started taking a leap forward to professionalize and introduce quality standards for the healthcare profession and the hospital industry. And then subsequently in 1951, the American Medical Association joined hands with Joint Commission of America, which was responsible for accreditation of hospitals. And that was the beginning of truly what constituted professionalism in the hospital industry when we started leaders rising to basically run them. Just a little historical flashback. One more thing. We talk about the world's best institute, the Mayo Clinic. Till today, the Mayo Clinic remains, after almost 160 years, the world's #1 institute. You can talk to Dr. Google or any other site. Reason why? A small hospital which was fostered by few brothers in a prairie town of Minneapolis at the end of the day, who came together with the Franciscan sisters to establish essentially a town home type healthcare facility. But why was Mayo Clinic different? And why till today? All of us in this room too, we truly, indirectly embrace a lot of principles that what the Mayo Clinic gave to the world and other institutions in the United States. The fundamental principle of the Mayo Clinic was, no single doctor is independent of the other physician. No one is singularly taller than the other. They brought in what we call as cooperation into medicine. Medicine should be practiced cooperatively, number one. Number two, their biggest asset was the employees. They believed in employee training. They understood the social ethos, pathos of the employees. They did not have a big HR at that time. There were no HR leaders. There was no screening thing. But they related to them. They treated them like the stakeholders. They did not dictate terms to them. Do this, do this. If you don't do this, you're punished. They were a part of the entire journey. That was the beginning of the model where healthcare hospital leadership brought into physician partnership along with administration and formed that model called PAP, Physician Administrative Partnership Model, which today many of us struggle, and particularly in our country. I'm going to come to that. So why the top institutes in America? My own alma mater, Baylor College of Medical, one of the largest medical centers in the world. Only China recently took over, the Texas Medical Center with 4,000 to 5,000 beds, with almost about 13, 14 hospitals, Johns Hopkins, the Mayo Clinic, the Cleveland Clinic, all of them continue to be in the top 10 for various specialties year on year. You can reach the US Newsweek magazine. Why are they in the top 10, top 12, and others are not able to dislodge? Because fundamentally they have not deviated, from the principles of leadership that would lead to, not only these outcomes and patient success, but also their financial success. So I want to just show you a few slides, just to once again, set the stage for. So this is the countries with the most hospital beds. I'll also tell you why I'm showing this before reflect a little more on the leadership lessons that we have learned. If you look at it, Japan has almost 13 beds per thousand, and India is not 0.5 now, it's somewhere we are 0.8 to 0.7. Oops. And the European hospital capacity, for you just give a quick glance. Those of you know geography well, perhaps you can identify, the map. There also, the hospital beds are way above what is the WHO standard recommendation. Now, hospitals in the West certainly are very lucrative. There's a reason why I put this slide here. An average hospital earns 1,000 crores per year. Now, why I'm mentioning this? The responsibility of leadership, how it really influences the outcomes. 1,000 crores, and look at the rest of the world. Australia, Europe, Asia, South America. Nobody is as close to the American average returns of a hospital, reason being, and that translates to their 4.5 trillion healthcare economy. Now here in India, it's very difficult to find data. I was looking for several graphs, and ultimately there was a thing called Statista. And I was trying to enroll in Statista many times. Panelists, I was just telling you, Sir Govind Harigaru, it keeps kicking me out. It won't allow me. There's a nice slide there about actually the Indian hospitals, but it's a quick glance to show. So we are significantly less than what is expected. Apparently, India needs roughly about 2.4 million beds. We hear from these different sources, and metropolitan cities are crowded. We have more beds than we require sometimes, but this requirement of 2.4 million beds, I'm sure they're focusing on including the entire rural India. And this is just to show you, at a glance, where is our healthcare industry? This is not the hospital industry. Our entire healthcare sector is growing at a CAGR of about 10 to 12, per year. And essentially, in the FY25, we're projected somewhere around $640 billion. Now, if you talk about the hospital industry alone, the hospital industry today is somewhere around $101 billion. By 2032, in India, by good sources, by good economists, this industry is supposed to be growing to somewhere around 195 to 200 billion dollars. So there is a significant growth that's going to be happening, literally doubling up from where we are, from 99 to 100 billion. down to $200 billion just in a span of 7 years. So we can all fathom the requirement of good healthcare leaders, healthcare professionals, doctors, and everyone from different walks of life associated with healthcare. And no doubt, health industry is poised to be the biggest employer in the country as we go forward. Now, what are the 6 responsibilities of a CEO or a hospital leader? This particular framework encapsulates all the 6 functions. Now, I have not pulled this out of a figment of imagination. This is something that has been acknowledged by the world leaders, not just hospital industry leaders. Even people like Ajay Banga, the president of the World Bank and former CEO of MasterCard, Satya Nadella's, Sundar Pichai's, they all are familiar with this model. The 6 great responsibilities of a real chief executive or a hospital leader, whatever you term, which is engage the board, and then you have the subsets. While you're engaging the board, you're looking at the relationships, capabilities, how you organize your meetings, connect with your stakeholders, social purpose, interaction, how you build your communities, manage your effectiveness. Are you a good communicator? Are you an empathizer? What is your leadership model at the end of the day? How are you recognized by your employees, by your peers, by your physicians? And mobilize to leaders that we have potential opportunity to learn from the others at all times, and always focus on aligning the organization, which means basically what is the culture of the organization and what is the organization design and talent. So far so good, correct? This is taught in the halls of management, economics, institutes. But why am I introducing this slide to you? Are we really practicing this? So when they interviewed the CEOs in the US of the hospital industry, hey, do you have time in a given day to manage all of these things? The answers were split. Most of them said they spin all these platforms very well. Some of them said we focus on some things disproportionately, on some of the things less given the needs of our institution. That's the way it should be. Because you can't just spend an equal time on everything. You have to identify what are the lacunae. A good leader has to identify what are the lacunae given institution according to focus and bring them to speed and make them comparable. So in general, when they did this survey and interviews of some of these top healthcare leaders, they came to a consensus that we put this matrix into place, we dedicate our times to this, we focus on financial well-being of the hospital, while we are engaging with all our stakeholders. When all this was happening in America, now what went wrong? Today, why the world is calling it's a broken system? And I'll address in the next 2 or 3 minutes. I went to America in 1983. I still go to America once in 2 months or 2.5 months. I'm still associated with the boards of America. I still sit in the presiding chair. I had the greatest opportunity from age 34 to be the chief of staff in a very conservative state called Texas and the largest medical center, which was in Houston, which was elected bodies. First station, broke many glass ceilings. So I was able to see the entire culture of people. How do they function? What is that they made the system so well? Now, historical flashback. Post-Second World War, what changed the American healthcare system was the introduction of the third-party insurance payment system. As soon as the World War was over, industry was fighting for workers. The only way to attract the workers was provide them comprehensive insurance. So who is going to provide them comprehensive insurance? The industries, the employers. Number 2, government stepped in. There was a massive funding for hospital infrastructure. Number 3, all the hospitals, most of the teaching hospitals, universities engaged in subspecialization and super specialization. And until then, fantastic, 50s, 60s. In the 60s, Lyndon Johnson introduced the Medicare and Medicaid Act. He said everyone should be included. Post-retirement, the nation should be taking care of those and should not neglect them. So this transformation was happening in the industry. Leaders were also transforming. Now, where did we start seeing? Until then, it was great. They were innovating, best medical education, Every child from India who had an opportunity would love to go to America. And today, no doubt, we Indians are leading the country. We're the #1 physicians from all angles, including from, as financially, entrepreneurially, leading academic positions and whatnot. So while this transition was happening somewhere in the 1970s or 80s, the cracks started showing. What was the reason for the cracks? What was to be a religious society with a few people, with a few doctors, who managed the institutions well, who were cared for the community help and patient-centric care, then the government came in, insurance came in, investors came in, public sector, relationships, all of these people came in, and they all wanted a seat at the board. When multiple stakeholders came in, there was divisive approach to healthcare. Each stakeholder wanted his or her, personal interests to be taken forward. So what was sitting in the room? The big elephant then sitting in the room was chaos. And as this chaos went into the rooms, American healthcare system started breaking. That's what I feel. I was trained and educated in the finest institutes. I sat on all these boards. I know how things were structured, professionalized, and you basically went by the rules and processes. Then corporations started taking over. Doctors were put down. Ultimately, legal systems crept in. And exactly that's what is happening today. Responsibility, the part of responsibility for the broken system is when multiple stakeholders, diverse interests, got in, and the doctors were pushed aside, then for the next 30 years, 3 decades. So they realized it, somewhere in the 2010 and 15s. Hey, what is going on here? Big systems, Mass General, the Cleveland Clinic, systems which are chains of hospitals like, what we have in this country. So they said, there is something wrong we're doing. We have an administrator with an MBA, MHA, Stanford degree, member of the American Health Executives Committee and all of these things. And why is that we're not able to financially successful or be #1? So they start questioning. So what they did, they said, let's put physician leaders. They said, they went back to the old 150 years back. I think physician leaders to partner with administrators was the best model at the end of the day. And if you look at today, every major healthcare system in America are physician CEOs. And not all of them have taken their MBAs or MHAs, but they learned through their jobs. Some of them later on studied or whatnot, got their degrees and whatnot. You take today the Cleveland Clinic, and everybody knows about Toby Crossroads example. Let me just digress for a second to talk about him. In the 2010s, Toby Crossroads, when he took Cleveland Clinic was at the bottom of the recognized hospitals, really ranked lowest. Cardiothoracic surgeon, Toby Crossroads stepped in. He did only 4 or 5 simple things. He said, who is the caregiver in the hospital? Physician said, we. He said, no. My all 44,000 employees are caregivers. And what did he do? He introduced badges. Everyone will wear a badge saying that they're caregivers. And doctors were upset. You cannot include a housekeeping fellow to be caregiver. We are the caregivers. At the end of this, he said nothing. That was one introduction. Second thing, he brought in patient dignity by changing the design of the gowns that patients wear. All of us have seen this every day in our hospitals. Patients are struggling to tie the knots and the back is showing. Sometimes things are slipping. So he hired one of the famous designers, Diane von Furstenberg. Those of you know, many of the women should know here. Diane von Furstenberg designed the gowns for the patients at Cleveland Clinic that went viral. That is only to preserve the patient dignity. Then he used the word pupil-centric healthcare, not patient-centric. He said pupil-centric. It's not just the patients, their families, the communities around. All of these people are equally responsible in how we impress upon them. So he organized multiple meetings and all of those things, you know. He went out on a limb at the end of the day. The board gave him complete freedom. You do what you need to do, but we want Cleveland Clinic back to be at the top. Just it took less than 10 years for Toby Crosswood to make Cleveland Clinic #1. How difficult are these interventions in life? These are very small interventions at the end of the day. So for all our healthcare leaders, for us, you know, to understand the perspective of leadership and how to manage, there are simple things that make an enormous difference. Your big picture, truly, will never be a masterpiece if you ignore the tiny brush strokes. And these are the tiny brush strokes that we talked about and many of the other speakers were talking about earlier this morning. Just I want to dwell upon about a minute or so on this. The team composition of your organization is extraordinarily important. Every team member should be considered to be important, and every important member should believe in the team at the end of the day. It's as simple as that. There should be cooperation, but not competition. This is not philosophical. I'll just give you an example of the forest. All of us, or many of us, might have driven to the forest. Look at the tall trees in the forest. The trees are vying for, all the trees are vying for the sunshine in the same space so that they can grow taller. In India, we have eucalyptus, we have bamboos, and we have sal, we have teak wood. They're all in the forest. Okay, so we think they're all competing with each other. Scientists have discovered this. Unfortunately not. Below the soil, some amazing thing is happening. The tree roots and fungi have partnered together, form this compound called mycorrhizae. And this mycorrhizae is connected to each of the trees by nurturing them with water, sharing the carbon, essential nutrients like phosphorus. And then they did this other experiment where the forest was denuded by fire. When they planted a single species of tree, they did very poorly. They did that. If you just take a eucalyptus, there's a barren forest, you plant it, it did not do well. So what is the moral of the story? In a given organization, high performers, high achievers, high employees or on the panel who have skill sets, try to share and connect with those who are also in a different levels in the organization. So you'll be able to build that huge forest at the end of the day. Don't look at yourself that you are the gigantic tree and the forest will be built. As I say beautifully in English, don't lose the forest for the trees. Correct? So don't lose for the trees. Don't be one gigantic tree or two gigantic trees at the end of the day. You have to incorporate everywhere. That's team composition. Treat the soft stuff and the hard stuff. Very important. What is the soft stuff? People, emotions. 71% of management is rooted in that. Nothing more than that. It is the game of the people. If your people are not aligned, if they're not emotionally aligned, if they're socially disturbed, if their family things are impacting the thinking and power, no matter how many classes or readings or teachings that you do, they will not come up. Very important aspect in healthcare leadership and all leaderships. So treat your soft stuff as the hard stuff and engage with them to understand them. Your chief human relations officer in the organization is not just alone responsible, but the CEO downwards to every leader has to connect them, empower them, teach them, see that they are your darling contributors. And that is the hard stuff to make it successful. Talent management is also very important. I just gave you the example of Toby Crossgrove. I don't want to further dwell on that. And last but not the least, culture, guys. It's all about the ultimate wisdom of an organization. When I came to Continental and studied Indian hospitals, I was appalled. With due respects to great CEOs in this country too. We have fantastic CEOs. Sanjay Singh is sitting here. You know, probably he was a born CEO. Probably started when he was a teenager. He says for 40 years he has been CEO, or 40 plus years. That's incredible. As young as you look, Sanjay. You know, so what I mean to say is that we have great CEOs in this country too, but I'll just come in one or two more slides. What is kind of, when the country's healthcare is an inflection point on many fronts, when the nation is targeting for 2047 to be the global healthcare leader, I'll just come to that, but remember culture. If you can remember this E-culture, which is ethics, your environment, how you explore, excellence that you build, and how you educate. Or you can remember the word Pearl, performance, manage it, empowerment, very important. There should be accountability. We can't just give some assignments and not accounted for. Extremely important. We all know here, this is very fundamental. Responsiveness of the people who are engaged, and of course, the local embeddedness of the culture is also extraordinarily important. Challenges of Indian hospital leaders. I just put this from my observations in India. I do not want to hurt anyone's feelings. I'm not directing to any hospital CEO. Unfortunately, it's not most of the times in the hospital leaders' control why these things are happening. We have adopted a transactional leadership. There are many forms of leadership, correct? Transactional, adaptive, and now the best form of leadership in healthcare is a servant leadership, what America and the global institutions are trying to follow. I'll just dwell upon that in a single sentence. But we are transactional. 90% of India's healthcare industry has become a transactional hospital, healthcare industry. Target-driven practices at every hospital. Kickbacks and commission is so spread out. It is nauseating when somebody comes into my office. I tell them, I resisted this for 3-4 years. This is nonsense to be paid. What is this? Anyhow, that's a different lecture. Unnecessary procedures. We all know, we all talk about it so that you can inflate your revenues. You can take it up and be responsible to the board and preserve your employment. Lack of transparency. 80 to 90% of the hospital, there's no transparency. And Toby Crossgo did one other thing he did. He put all the metrics of Cleveland Clinic in the public domain. My cardiothoracic mortality is this many number of people died, this many complications I had in the hospital, this many cancer deaths has happened. There was another great thing that catapulted for voting to the Cleveland Clinic to be #1. So we need some transparency. I'm not talking about all. We can learn through our way and become a transparent healthcare providers. Inadequate regulation failures. If today America is following and global leadership is that they have structured this thing. They follow to the structured principles. They have guidelines. They cannot waver. They cannot shoot whatever they want to do. Fraudulent activities and neglect in the public sector and often lack of accountability. If we are to be global leaders by 2047, we need to make quality our cornerstone. We need to scale artificial intelligence to digital infrastructure, but this will not be the mantra. We keep on talking digital, 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 and 80% of them are not even aware of what that means. We have to be patient. This is not going to revolutionize right away. But there is one point I'll make. A speaker made earlier this morning. We are not going to lose our jobs. If you all need Medscape, some astounding minds have written. It was a beautiful debate and a dialogue. 60% of the physician jobs will be eliminated by 2050s with advancements of artificial intelligence that is going on, and that will be a reality. Invent in innovation, not just scale, and unlock your sustainable investment and redefine medical travel. I'm going to skip this few slides. So when dealing with people, remember, you're not dealing with creatures of logic, creatures of emotion, the soft side, the soft power. The strength of the team I met is each individual team member, and the strength of each member is a team, and everything should be made as simple as possible and not simpler. Albert Einstein said so beautifully. And before I can do things you cannot, and you can do things I cannot, and together we can do great things. Always remember that. It's my last slide. Before I ask with the permission of the chair, just give me 30 seconds, sir. I want to just reflect on one important point of governance in India, in the healthcare industry. Why this American leadership succeeded so well, admired, and all of those things. Of course, they're going to the wars of, they're not able to manage. When you're spending 9.3% of the healthcare costs, you're funded only 3.6%. This financial gap is causing all the chaos in America today because they're not able to control the costs and meet the needs of the people. That's a different story. But what is happening to the governance? See, in governance there, so beautiful. Governance is also Governance is also professionalized. You cannot have anyone that you like, your father, your son, your brother, or to be on the governing board. Because I have sat on the governing boards where a flower shop owner, a funeral home director, a power plant president, a bank president, lawyers, scientists, that's the composition of the American boards. These stakeholders bring in the diverse views from the communities, which they debate, translate it, and then implement it. And what happens in India's governance, especially with the bigger hospitals, bigger chains today, very unfortunate story, but I stand up for that. Our governance needs to be looked at very carefully. It has to be honorable. It has to be structured appropriately so that they give right message to the hospital leaders and continue to enhance our industry and become those global leaders. Lastly, excellent is never an accident. I'm just going to add one word with due respect to philosopher Aristotle. Excellent is never an accident for hospital leaders. Thank you.